Welcome to the State of Health. I'm your host, Karen Bowling, Cabinet Secretary for the West Virginia Department of Health and Human Resources. Here's a scary fact. Breast cancer is the leading cause of cancer-related deaths among West Virginia women. Unfortunately, the same is true for heart disease among women in the state. So ladies, we're going to focus this half hour on how DHHR can help you take control of your health in these areas. And men, if you have loved ones, this life-saving information is for you too. Joining me to talk about just how serious this is for women in West Virginia is Dr. Rahul Gupta, our State Health Officer and the Commissioner of the Bureau for Public Health. Dr. Gupta, thank you for being here.
Thank you for having me, Madam Secretary.
Let's just talk about how serious is breast cancer and cervical cancer in the state of West Virginia?
I think the breast cancer and both cervical cancers, not only do we have one of the highest rates of deaths from that in the nation, but in addition to that, it is preventable. And if it's caught early, then we can do a lot of treatment perspective as well as rehabilitation. So these are diseases that we have women dying across the state of West Virginia that can be largely avoided, but also treated and cured.
And I think that's important. You know, I think women out there need to know what are the risk factors, what are things they need to be aware of as it comes to breast cancer and cervical cancer.
Absolutely. For breast cancer, obviously, having a very early starting your periods and having a late menopause, not having children, smoking is a big one. Genetic is probably the biggest one. So if you have somebody in your family who's had early breast cancer, make sure that you talk to your doctor about getting yourself screened. Obviously, we have newer factors such as obesity and a number of others. For cervical cancer, it's a little bit different. Having multiple childbirths, having smoking is again a big risk factor and there's a number of other risk factors that also happens for cervical, but obviously cervical cancer is because of something called HPV, and we can talk about that, but this is an infection that leads to a cancer, unlike breast cancer.
You know, it's interesting you were talking about risk factors, and we talked earlier about, you know, for women, we're talking about not just breast and cervical cancer, but heart disease. And some of those risk factors that you just outlined really are also risk factors when it comes to heart disease in women, in particular smoking. Or
absolutely.
Other things that women should think about in terms of the heart disease piece of this and what they should be thinking about for risk factors?
Absolutely. I think physical activity, when we talk about obesity and eating well, making sure your cholesterol and your lipids are checked for, don't have diabetes, those are things that are important just in terms of health. But one of the things also in cervical cancer is multiple sexual partners, and we talk about diseases other than cervical cancer. So there's a lot of value to healthy living and healthy lifestyles.
Oh, absolutely. Now, in West Virginia, you know, we talk a lot about the importance of getting screened. How do we rank in comparison to the rest of the country in regards to screening?
Well, thank you for asking that question, because screening is perhaps the first step to detecting early and avoiding the disease altogether. We are not very highly ranked. Unfortunately, we have a lot of women in West Virginia that either pass it off or are not taking it seriously, life-threatening disease. So we're somewhere in the middle, lower middle category in the nation for screening for both of these. And that all it tells us is there's a lot more we can do to make sure that we talk to women and we spread the information, such as in this program, and to ensure that we can get folks to get screening done.
You know, and I know that's very important. Our Bureau for Public Health, I mean, that's an emphasis, health promotion and changes in lifestyle. What do you suppose are some of the reasons that women don't take this seriously? Do you think it's that we need to get the word out more, the importance of maybe visiting their doctor on an annual basis? Are there some things that are out there that you think that we could do to make a change and get those screening rates up where they need to be?
Well, absolutely, Madam Secretary. I think all of those are issues. I think women often are engaged in West Virginia in their homes, taking care of their family, and doing everything that needs to be done, then you don't get enough time to think about yourself. So I think that's one of the important parts, that if you do get your annual physical, make sure that at what age you are, you're getting the appropriate care and preventive screenings that helps a whole lot in ensuring that you don't end up having a disease that's much more difficult for your family and expensive and heartbreaking to treat at the end. So a lot of those factors, I think, as much as awareness can happen, education can happen, that you can only help take care of your family, friends, and neighborhood if you take care of yourself first.
Oh, and I love that philosophy. I think that is important. I do think that's a little bit of a cultural consideration in West Virginia that, you know, we are very family oriented, and the women are, you know, the primary caretakers in many ways, but we do forget sometimes to take care of ourselves. So I think that's an important factor, and I thank you for mentioning that. You know, earlier you talked about HPV, and I do think there is important education about HPV and the prevention of sexually transmitted diseases and how that contributes to cervical cancer. Can we talk a little bit about that?
Absolutely. Absolutely. The human papillomavirus, or HPV, is the most important and common factor causing the cervical cancer. And that usually happens through sexual transmission more commonly, but it's asymptomatic, meaning you can have a wart or a lesion, but you don't have to have it in order to get a cancer. It can go away by itself, or it could stay quietly and cause cancer later on. And that's why it's important to do everything we can do to prevent that. There's a few things that's important. First is the vaccination. There's an HPV vaccines, multiple vaccines that are licensed now for boys and girls, and it's important. That's perhaps the most important part. We're talking about a vaccine to avoid a cancer. We think about vaccine generally to avoid a disease, a communicable disease. In this certain case, we're avoiding a cancer, which is much more impactful and effective. And then we talked about screenings a little bit, that when we do screening, there's ways of testing for HPV and then treating it early so we don't have the end result of that HPV infection, which is cancer.
You know, we talk about women getting a Pap test. Does that test actually help determine whether or not you have HPV or other types of sexually transmitted disease that can lead to early detection?
Yes, absolutely, that's true, because we have advanced so much that as compared to a typical Pap test, now we're able to detect for the presence of HPV. And oftentimes, in addition to seeing the microscopy of that tissue to see if there are early cancer changes, we can also see if there's infection there from HPV, and that helps take care of the problem. Very early onset, it's very cost-effective and health-effective, so in long run, women don't have to worry about developing such a life-threatening, disastrous cancer that is so, it's taking a lot of lives in West Virginia.
And as we sort of close here, what do you tell your colleagues out there? You know, you're a physician, this is important. What do you share with your colleagues to really try to encourage them to get women into their practice to get these tests?
I think the most important part for any physician is to encourage general lifestyle factors, what we call risk factors. So make sure that when we talk to women, of course men can also have breast cancer, when we talk to women, talk about preventive screening, vaccinations for girls, and ensure that you don't forget to talk about reducing smoking, reducing weight, healthy habits, eating right, exercise, all those things that are meant to reduce the risk factor so we don't have not just the cancers but a whole host of diseases, including what you mentioned, the heart disease factor.
Thank you so much.
Thank you.
Coming up, we're going to take a look at what might be the best program you've ever heard of, or what you would think you would qualify for when it comes to fighting breast and cervical cancer. Stay with us.